Thank you very much, Chris, for your questions. And we are terribly sorry. The line is not very clear, but Dr. Saif's got better ears than me, obviously. He heard your questions, and I hope he answered your questions, not somebody else's question. Regarding the National Day, everybody knows how important and how special the month of November to all of us in Oman, not only the Omanis, to everybody who lives in this country. And the plan was to have, since it's the 50th anniversary, the plan was to have a truly big celebration, including the military parades, other activities. But I think this is a message from His Majesty Sultan Haytham to all of us. Cancelling the military parades and other activities that can lead to gathering is a very good example of giving to the public of how important people's health and life to His Majesty. So the celebration will be definitely there, but it's in our hearts more than our gathering in places and spreading the virus. And I think that's what His Majesty Sultan Haytham wants, and what late Sultan Qaboos Tayyibullah Thara would have wanted, us not to expose ourselves or others for the danger of this virus. So the National Day is the 18th of November, we all know, and unfortunately, most of the activities have to be cancelled because of this virus. Thanks, Chris.
شكرا جزيلا لك معاليك، ونترك الكلمة لك.
قبل الختام كالعادة لابد من إعطاء بعض المعلومات باللغة الإنجليزية لغير الناطقين باللغة العربية في السلطنة. Ladies and gentlemen, it gives me always great pleasure to have this interaction with the journalists and to talk to you about COVID-19 and the work that's been done by the Supreme Committee and by all stakeholders regarding this virus. And as usual, I start with the numbers. Yesterday, we had 256 confirmed cases registered in Oman, which takes our total number to 119,442 cases. Unfortunately, 5 persons lost their life yesterday for this virus, which takes the total number to 1,326. We have 10 admissions to all the intensive care units in Oman yesterday. The total patients, number of patients in the intensive care units in Oman as of this morning, 135 cases. The admission to the wards yesterday was 35 cases. The total admission to our healthcare facilities, 318 patients. From the healthcare staff or workers, unfortunately, we have 5,000 cases from the beginning of the pandemic until now. And worldwide, you are following the news, I'm sure, and you are aware that the number of cases have exceeded 52,500,000 cases, and the number of those who died because of this virus exceeded 1,300,000 cases. So it's obvious the virus is still with us, unfortunately. It is still spreading. The number varies between countries and even within the same country. I'm delighted and pleased that our numbers are coming down nicely and steadily. There are many reasons for that. One of it, I believe, that the level of knowledge and information with all of us have increased significantly. The number of those of us who are applying the healthy practices that we know definitely has increased. There might be some scientific reasons as well, and there might be one of the reasons is I think people now gathering outdoors instead of indoors, and that definitely the risk is less than being in a closed, confined place. If you remember, I always say, remember the 3C: crowded places, close contact, closed places. But please, I don't want this good news of our numbers coming down to be an indication that the virus is leaving. We are getting tired of this virus, that's true, as Dr. Tedros said. But unfortunately, this virus is not tired of us. It is still here. It doesn't look for us, as I said in Arabic. We go and look for it in our gathering and being very close proximity to others who we don't know whether they have the virus or not. And I said something at the beginning of this pandemic. All of us should consider him or herself carrying to the virus, i.e., imposing risk to a close contact. Therefore, he or she should wear the mask and keep the physical distance. Also, in return, you should consider every person you meet as a risk, as a carrier of the virus, who can pass it to you if he or she and you are not wearing masks and keeping your physical distance. I'm delightful that one of the journalists, Adil Badi, asked a question about a rumor which has been very widespread in the social media, that WHO, inverted commas, said that we don't need to isolate patients who have this virus. We don't need to quarantine patients who have been in contact with somebody who had the virus. That is a true lie and rumor. No scientific basis for that whatsoever. Everybody who is carrying this virus is a risk to others to pass it to them. Therefore, we need to continue taking precautions. We need to continue doing the right things, which you all do and know how to do. I don't know what all do, but I know all of you know what to do. As you've been following the news, the cabinet was chaired by His Majesty Sultan Haytham on the 3rd of November, and he is following the pandemic locally and worldwide and updated with all the situations. He is very keen for us to continue in the Supreme Committee working under his directive and taking decisions that we definitely always try to balance between the effect of the virus on healthcare and health facilities, and also the effect on the social, economic, and well-being of the public in Oman. It is not always very easy to strike a right balance. You've heard the news about opening certain worship places, mosque, which has a capacity of over 400 individuals, but with very strict and clear conditions. Firstly, and this is not only for going to mosques, any person who is having symptoms of respiratory disease, sore throat, cough, fever, pains and aches, they should never mix with others. So definitely they should not go to a mosque or a worship place. 2, within the mosque or worship place, they should be and they must be a physical distance of at least 1.5 meters. 3, wearing the mask is mandatory. 4, using hand sanitizers or washing your hand with soap and water before going in and after you leave is a must. I think the idea of opening more places, including mosques, is not to allow the virus to spread again and we go back to a time that I wish we'll never go back to, where we had 220 individuals in our intensive care units in Oman for one disease, COVID-19. Remember, we have intensive care patients for other conditions as well. So please, don't take from the numbers coming down a message that we can relax. We can go to business as usual. No, we cannot. No, unfortunately, the virus is still here. And again, and I know I repeat myself, but what can I do? Some of, unfortunately, viewers, I don't think whether they don't get the message or it's not clear enough. Let me repeat it again, that this virus can affect any age group. And I know, and I'm talking to the younger population, which is the majority in Oman. Even if you think that if you get this disease, it will be mild and then it will leave you alone. To start with, that's not guaranteed. We had people who are unfortunately died below the age of 20. We had children, below 20 also in the intensive care units. That's firstly. Secondly, even if you have mild conditions, you may pass this virus to somebody that you love, your parents, your grandparents, your spouse, who are having chronic diseases or other comorbid conditions like obesity, and the consequences can be devastating. Thirdly, up until now, we do not know the long-term consequences of this disease. I've mentioned in Arabic this morning, I had in my office one of my colleagues who had the COVID-19. He was in ICU for about 6 weeks. Luckily, alhamdulillah, he left ICU. He's alive. But not without, unfortunately, still consequences of COVID-19. He had disturbances of his heart rhythm, and he had to be on 2 different medications, even though he did not have pre-existing heart disease. He lost more than 35% of his weight. His muscles are still weak. So for those of you who think this is just cold and flu and it will pass away, please reflect and think. And all of you must know somebody who had this disease and had it badly. All of you must have heard, if not directly, of somebody who died because of this disease. Yes, there are excellent and good news regarding vaccination. And you've all heard one of the companies who are producing vaccines announcing that the efficacy of their vaccine is 90%. But let me be very clear and frank. This result is from the preliminary data of phase 3 trials, based on a clinical trial, phase 3, which about 43,000 participated in it. Usually, for safety purpose, we need to wait for much longer time than the 2 weeks between the first dose and second dose. So yes, there is a light at the end of the tunnel. Yes, there are some encouraging news, and we hope to hear more. I've mentioned also in Arabic that another company, which they have a vaccine in phase 3 clinical trial, which is the final stage of three phases of clinical trial. They also said or claimed that the efficacy of their vaccine is 92%. But in addition to efficacy, what we need to wait for is the safety. And let's assume and hope that this vaccine, and about 11 companies already in the final stages of phase 3, let's assume and hope that they will be effective and safe. That's excellent. But remember, there are 7.5 billion individuals on this earth, and that's what we will aim to vaccinate people on this earth only. Okay? We aim to vaccinate 40% in Oman. How much can these companies produce? And when would the production start? When would they get the license to start producing? As today, as yet, we are not aware, and I have a very professional and dedicated team following the vaccine studies everywhere. We don't have a single company who've been, their product, their vaccine have been registered to be used outside emergency use and clinical trials. What I'm trying to say, the best way to avoid becoming sick, the best way to avoid spreading this vaccine, wearing the mask properly and appropriately, keeping your physical distance at least 1.5 meters, hand hygiene, which you all know and it's available, and respiratory etiquettes. When you are coughing and sneezing, if you don't have tissues handy, cough and sneeze in your elbow to avoid spreading the virus. This is a special month for us in Oman, all of us, whether Omanis or expats. We all were hoping to have the joy of celebrating the 50th National Day in a big way. But again, His Majesty put people's health and life before everything else. And we should all do the same. I wish you all well, and please remember to keep your physical distance and wear your mask. Thank you very much.